Hey, Jeff here. I have 7 exercises to go through, and this is going to work some muscle instability in the lower back, getting into the glutes, hamstrings, and abdominals. So starting off is a 90-90 face-up lying bridge. You're going to be on the floor, you can be on a bed. If you have something to put up for your heels, we want to be in a 90-degree position at the hips and about a 90-degree position at the knees. So I'm going to use the bench on the floor. You can also be against a wall, just with your feet on the wall. And if you're pressing enough, then that will work instead of having a bench. So we're going to have a ball, a pillow, something like this in between your knees. Give it a solid but not too tight squeeze. Push your heels down onto the surface just slightly so your tailbone is coming off of the floor. We don't want to do a traditional bridge like that. That's too much for this exercise. With the tailbone coming off, we're going to get a shift in the pelvis. So it's going from this position to a more posterior tilt. Now, have your hands on abdominals just underneath your ribs. We're going to breathe in. So this cycle, this set is going to be 5 to 8 breaths. So have your tongue on the roof of your mouth. Breathe in through your nose very quickly. Expand as much as you can, and then slowly sigh out the breaths as far as you can take it with the diaphragm. When you think you've exhaled enough, there's probably a little bit more that you can do that will further engage this area and just does a lot of things throughout the body. So start off tongue on the roof of your mouth, breathe in through your nose. Then do a sigh exhale. And doing that during the exhale, feel your muscles engage, side oblique abs, front abs. Keep the tailbone off the ground. When you go through another 4 or so breaths, and then at that point, you can release the tightness on the hamstrings and then lower down all the way to the ground. So next exercise is a stagger step, and just use a book, something that's just a couple of inches. You don't want a lot of height on there. We're going to do this on both legs. You will probably feel one leg is a lot easier to do, less challenging than the other. So that's the one you need to concentrate on, maybe get an extra set or two or a few more reps in on the more challenging leg. So we're going to start off raised position there. Bring that over so you can see me. You're going to have the foot solidly on that riser, so we want the inside part of the heel, and then right at the base, coming in towards the foot of the big toe. So we want that metatarsal head and the inside or medial aspect of the heel, calcaneus, to be solidly on the raised surface. The forefoot is going to be half a shoe length in front of the raised foot. You're going to have a ball or a pillow, something like this, in between the upper legs, just above the knees. Hold on to something. You don't have to, but if you find yourself leaning forward too much, then have a wall, dresser, or chair, something you hold on to keep you from leaning forward. What we want to do is push back and down on the raised side. So a little while you're going to feel this glute muscle starting to talk to you because of that position. And then we're going to do a hip rotation. So all we're doing with the hips is what I'm doing right now with my torso, which is not part of the exercise, just a demo. So back down in this position, get the hips moving. So we're getting internal, external rotation in the hip joints. While one is internally rotating, then the other one is externally rotating, and vice versa. Make sure while you're doing this, your feet are solidly on the floor, either on the raised surface or the floor. Metatarsal heads are just right behind the big toes, and then the inside part of the heels, making the solidest contact. So I'm not sure how many of these you can do when you've pretty much had enough. Either your quads or glute area is talking to you. Then switch. Raised foot is the back foot. Half a shoe length forward on the lower forefoot. And again, in between with the ball just above the knees. And then get hip rotation while you're in a partial hip hinge position. Feet solidly on the floor. And you know when you've had enough. All right, moving on, we're going to do knee raises with a band. You don't have to use a band, but if you can do these quite a while, 15, 20 of those, then it's time to add a little bit more resistance. All right, so you have your band. Stirrup one foot. And you can do this leaning against a wall. So if you feel like you need more stability, or you feel that your hips are starting to move while you're doing this, then just lean against a wall. Have your feet and heels a few inches forward from the wall. Have your pelvis, especially the top part right here, pushed up against the wall. You can have your hands out to the side, or you can hold onto something else for stability to keep you from moving. And if you don't need that, then do it this way. So have 1 foot stirruped, drop the band down. Feet farther apart is going to give you less resistance. Closer together is going to give you more resistance when you do that lift. Bring up and down. And as you're doing as much as possible from the knee down to your toes and your heel, keep that pretty much straight up and down. So if you find that you're doing something like that, then really try to watch yourself either looking down, not the best way to do it, but some sort of mirror video screen, something that shows you your image so you can keep that tibia in vertical alignment. You want to stay up pretty high on that. If you can do more than 20 of those, then it's time to either get a little bit thicker band or have less distance between your feet when you start off. So finish that one, loop the other side, drop down, up and down, all right, good. Next are internal rotations with the band. So internal rotation is coming in this way. So with the leg, it's going from either outer position or neutral position, where you're rotating here in the hip in towards the central line of the body. So with the internal rotation, we need to have an external anchor for the band. So you can have that under a door with a weight or a ball or stick or something on the underside of the door to hold that. If you have something low like this, you can wrap it around, loop it through. You can do it around the leg of a couch, bedpost down low, just anything like that that's going to be solid enough that'll withstand a few pounds of resistance without moving. So on this one, I have it on the arm On my cable cross guy. So I'm going to stirrup in, have the band a little bit closer to the toes than to the heels. You're going to walk out so you have some resistance starting off. You have the standing leg, the banded leg is going to be the rotational leg, obviously. Toes up on this side, you're going to pivot on your heel. So you're going to go into external rotation to start off, and then the work part is on the internal rotation. So rotate in, slowly release, rotate in, slowly release. And you want to do that as much as you can with the muscles here. So what we want to avoid is doing something where we're getting a whole orientation with our body or an orientation with our hips. We want to keep it all with these muscles. So rotate in and out, in and out. When you finish with those, you'll know when you've had enough on those. Then switch to the other side, do the internal rotation. If you find one side that is markedly weaker than the other, maybe give one an extra set or so to get that caught up with the stronger side. Now we're going to move to leg external rotation, which is going outward. So coming out like this. So you can do it with an anchor point again, or you can loop around one foot and step down and have your anchor point right there. So either way, I'm going to do it this way since it's already set up. So I'm going to go out far enough from the anchor point so I got some good tension here in the band. Excuse me. Standing leg. Heel is the pivot point on the working leg. So we're going to go inwards to the internal rotation starting off, and then the work part is bringing the toes outward. So pivot on the heel, pivot on the heel, and again, I'm going to put my hands right here so you can see that my pelvis is not moving. I want to get as much work just in the hip joint with these muscles up here as possible. All right, that's all 7 of these exercises. If you have any questions, get a hold of me, and I can go through a little bit more description for you on that. So thanks, have fun. Hey, I forgot the last 2 exercises. So number 6 is an abduction, and that is bringing a body part away from center line of the body. So we're going to do leg abductions. Anchor point, band, stir up your foot, hold on to something, chair, anything that you need to for stability. You're going to face more towards the anchor point, still at a little bit of an angle away, and this is straight out from the body, this is straight back. We're going to cut that right down pretty much the center, so about a 45-degree angle from these two. Standing leg, banded leg, you're going to come out at about a 45-degree angle, and you may feel this more on the standing leg. That's pretty normal. Get as many reps as you can before the muscles start to fatigue, like a full fatigue, and then switch legs. If you find one leg is easier than the other, then maybe get an extra set on the leg that's a little bit more difficult. Now we're going to do adduction, adduction, which is bringing in towards the center line of the body. So we're going to use that same anchor point. You may or may not need the same resistance of bands. You may have more strength or less strength in that, so adjust accordingly. Hold on to something for stability. You're going to walk out so you have some tension on the band. Standing leg, shift your weight there. Bring into the body, slowly out, in and out. At any point you can tap down, regain your balance, and still hold on to something. If you at all think you need to, then do in and out like that. So that's working the inner muscles. All right. Well, again, have fun with those. Those are your 7. Any questions, get a hold of me.